Okay, so this is just a quick little tutorial for nursing service for use with the Mackay SERVO U ventilator. Several different screen displays that you may see on the screen, and as it showed in the video, this is turnable, so wherever you're sitting, if you need to turn it so that you can view it, it's easily turnable. But this screen, whenever you look at this screen, the settings, the ventilator settings will always be at the bottom of the screen. So this is what we call the family view, which doesn't have a lot of graphics on it, so it's just nice and clean as the family members are in the room. But you'll have your patient data on the right-hand side of the screen and your ventilator data on the bottom of the screen. So in this one, we can see that the patient is on a PRVC mode, which is pressure regulated volume control, which is an assist control mode of ventilation. They're on an O2 concentration of 40%. They're on 5 a PEEP. The respiratory rate is set at 15 and tidal volume is 400. So that's where you'll get your settings for what the patient is on and for your charting purposes. On the right hand side are the patient measurements, and one number will be important for nursing to look at right here is the respiratory rate, which is in green. So this isn't a simulated patient, so they're not actually breathing. So the respiratory rate is 15, whereas the rate on the ventilator is set at 15. So the patient is not breathing any on their own. This rate could be more, it could be 18, 20, 30, and the ventilator is still set on 15, which means the patient is breathing at a faster rate. Tidal volume, you can read here. The measured tidal volume is 390. We have it set on 400, so this actually gives what it's measuring as an exhaled volume from the patient. And a minute ventilation on the bottom, and up top here is peak pressure. So the big thing again that nursing will be considered with is the respiratory rate right there. Another view that you might see that we might have it on is this screen, which is nice to have this screen up. If you're reading it from a distance, you can turn this wherever you're sitting at the nurse's station and be able to read these numbers very easily. Again, at the bottom is the ventilator settings, what the patient is on. On this screen, you'll actually see the mode at the very top left-hand corner. So it says PRVC mode. And down here are the settings. Again, 40% concentration, 5 a PEEP, respiratory rate of 15, and tidal volume of 400. And then in the center of the screen here is where you're going to read your patient data. So again, the respiratory rate for the patient is in green, it's 15. Measured exhaled tidal volume, a measured PEEP, peak pressure on ventilation, and this number over here is minute ventilation, liters per minute. So again, nursing's mostly going to be interested in is that respiratory rate and the ventilator settings at the bottom. Now this one also has alarms. It has high priority alarm and a cautionary alarm. High priority alarm will give you a verbal beep, and it will also flash red. Let's see if we can simulate a high pressure alarm for you here. Maybe. So you see it's flashing red, means it's a high priority alarm. If the alarm goes away, then of course it'll go away. There we go. If it continues alarming and you want to silence the audible alarm, so it's not so loud for the patient, you press this little bell at the top on the left-hand corner. That's an alarm silence. It will silence the alarm for 2 minutes. And after 2 minutes, it'll reset. If the alarm has not been corrected, it'll start alarming again. And you would have to press it again to reset the alarm countdown for 2 minutes. Let's see if I can get a cautionary alarm for you that will flash yellow. That's showing PEEP alarm is a cautionary alarm yellow. Again, we can silence it there. And then once it's corrected, it goes away. And just to remember, any of these alarms, if they can't be corrected, that low PEEP was just the patient was disconnected. So you want to go in and look at your patient, see if you can identify any issues. If it doesn't correct, respiratory can't get there quickly enough for you, you can always take the patient off and ambu them with an ambu bag until someone can get there to check the ventilator. We're still counting down on that, but if you hit it, it will reset it also. So we're back on, the alarms are back on. Another quick little thing for nursing is at the bottom left-hand corner is 100% O2 boost. So if you're going to suction the patient, if you're going to be turning the patient, stressing the patient in any way, if the O2 sat drops and you want to give them a little boost of oxygen, you can press and hold that 100% boost, and it'll come up and show you it's giving them 100% oxygen, and it actually counts down. It'll give it for 1 minute, and then it'll reset back to what the ventilator was set at previously. It will not stay at 100%. If you want to cancel it yourself, you just hit the red X button, and it goes back to the 40% concentration. So the two buttons the nurses will most be using is the top left hand, which will be the alarm silence and alarm reset, and the 100% O2 boost there, which it tells you tap and hold. So, and then X out of it. And that's really about it as far as tutorial for nursing service on the SERVO ventilator.